Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hi everyone. Today we're going to talk about Nimesulide, a medication that belongs to the group of non-steroidal anti-inflammatory drugs. To begin, what is Nimesulide? Nimesulide is used to relieve pain and inflammation. It is very useful for treating arthritis, menstrual cramps, and other strong pains like toothaches. And how does it work? Nimesulide works by blocking substances in our body that cause inflammation and pain. This is how it manages to relieve pain and reduce inflammation. Now let's talk about the dosage and the correct way to take it. It is normal to start with 100 milligrams twice a day. It is important to always take it after eating to avoid stomach problems. Do not take more than the dose your doctor tells you to take and follow their instructions exactly. But watch out, Nimesulide can also have side effects. Some of the most common are nausea, dizziness, and stomach pain. If you notice something more serious, like difficulty breathing or swelling, seek medical help immediately. It is very important not to take Nimesulide if you have serious liver problems or if you have had allergic reactions to other anti-inflammatories. And remember, always consult with your doctor before starting any treatment. In short, Nimesulide is an effective medication for pain and inflammation, but it must be used with caution. Follow your doctor's instructions and protect your health. Thank you for watching this video. If you have any questions, do not hesitate to leave them in the comments. See you soon.
If you've made it this far, let us know in the comments why you're using this medicine.